Greetings from Lobby 99. Hope you're well. But what if you're not? Anything could happen at any moment, whether it's cutting your finger slicing a bagel, waking up in severe pain, or something much more serious. Any one of those could send you to the emergency room, and possibly a stay in the hospital. And everyone who helps you there needs to get paid, from the doctors to the x-ray technicians to the pharmacists. Even the company that sells the bandages the nurse puts on you needs to be paid. It all adds up to a lot of money very fast. So who pays all that money? You, of course. Who else should? The fact is, one inherited disease, one split-second mental lapse that leads to an accident, and your entire life savings could be gone. If you have health insurance, your insurance company might pay a large part of the bills. But where does an insurance company get the money? It collects dues or premiums from you and thousands of others. That balances the cost between those who need the most and those who need it the least, with those needing it the least protected in case their situation changes. Most of that money goes to pay healthcare providers. The leftover part that doesn't directly go toward healthcare is referred to as the company's overhead. That money pays for things like salaries, executive bonuses, and shareholders. There's one more possibility. A government entity, either at the state or federal level, can pay providers. Programs such as Medicare, which primarily insures seniors, Medicaid, which primarily insures those with low income, and the Veterans Administration are examples of the government acting as an insurance company. But rather than premiums, the money to pay providers comes from a tax. Another difference is that the government doesn't have to pay executive bonuses and shareholders, so more of the money it receives can actually be used directly to pay providers. So what does all this mean for you and the overwhelming majority of Americans? One is that people who provide you with health care have to get paid. And two, regardless of who writes the check, the money has to come from you and other Americans. Therefore, it makes sense that any discussion of public policy involving health care ought to include a discussion on how to provide the best value for the money you spend. Thanks for your time. We hope this helped you better understand the actual situation when you hear discussions on healthcare policy now.